Hello everyone, this is Dr. Tanisha Bhatnagar and welcome to this academic video session by Dr. B.R. Ambedkar, Open University on the topic of digestive and genitourinary system. Have you ever thought about how the food that you eat gets digested in your body or how urine is formed in your body? Now coming to the significance of understanding these two systems for HHCM students. It is important for better coordination in patient care with the clinicians. It aids in resource and facility management, and it also ensures quality, safety, and regulatory compliance. Now moving on to the digestive system. The digestive system is responsible for breakdown of food into nutrients that the body can absorb easily and use for energy, growth, and repair. It consists of the alimentary canal, which starts from your mouth down to the anus, and it is associated with different glands and organs like liver, pancreas, gallbladder. They assist in the process of digestion by secreting different enzymes which help in breakdown of food. The process of digestion includes of mechanical and chemical digestion together, which help convert large food particles into tiny, simpler, absorbable forms. Moving on to the layers of the gastrointestinal tract. The alimentary canal is made up of different layers. Consider of it as a long pipeline. Each layer has a different function. Mucosa, which is the innermost lining, helps in secretion, absorption, and protection. Then the submucosa, which comes after the mucosa, contains the blood vessels, nerves, glands for the support. Then comes muscularis externa. It is a layer of smooth muscle which is responsible for mixing and moving the food down in the alimentary canal. Then comes serosa, which is the outermost protective layer that reduces friction with the surrounding organs. And moving to the components of the gastrointestinal tract, starting with the oral cavity. You eat your food through your oral cavity. But did you know that the digestion begins in the oral cavity itself? Yes, thanks to saliva. The saliva is produced by the salivary glands. These salivary glands are of different types based on their location. That is, three major types: the sublingual, parotid, and submandibular. Then this food from the oral cavity moves down into the esophagus, which is a long muscular tube that helps in transportation of the food by peristalsis-like movements, which is wave-like movements. So each bite you eat gets transported down by the esophagus into the stomach, which is a J-shaped organ. The digestion of the food properly starts in the stomach, where the proteins get digested using acids and enzymes. Then the food from the stomach moves into the small intestine, which is a long coiled tube, and it digests food and absorbs nutrients. Most of the absorption and digestion occurs in the small intestine. Then the food from the small intestine moves into the large intestine. The large intestine is mainly responsible for absorbing the water, and it makes the leftover substance into a solid feces form, which can later be excreted from your body in the form of waste. The liver is an associated organ in the digestive tract which produces bile and processes nutrients, and it also detoxifies. The gallbladder is a small pouch present under the liver which stores and concentrates bile for fat digestion. Then comes the pancreas. The pancreas release digestive enzymes, and they also help in regulating the blood sugar levels by hormones such as insulin. Then comes the rectum after the large intestine, which stores the feces temporarily before the elimination. Then at the last, the anus controls the release of the feces during defecation. The process of the digestion mainly involves 4 steps, that is, ingestion, digestion, absorption, and elimination. Ingestion is when you eat or ingest the food. Digestion is when the complex food particles are broken down into simpler absorbable forms by chemical and mechanical digestion. Absorption is when the nutrients from the food are being absorbed into your bloodstream in the small intestine. Then elimination is when the waste product or the leftover material gets converted into a solid fecal form, fecal matter, which is then eliminated outside of your body via the anus. Some of the common disorders of the gastrointestinal tract, which you can see in a hospital setup, are starting with GERD, which is the gastroesophageal reflux disease. As you can see, the digestion process in the stomach is aided by acids and enzymes. Sometimes because of overeating or when the sphincter between the esophagus and the stomach doesn't work properly, this acid starts refluxing back into the esophagus. The stomach has a lining which protects the stomach from its own acid, but the esophagus doesn't. So this acid, when it moves up from the stomach into the esophagus, it starts eroding the wall in the esophagus and causes ulcers. If not treated early, this can eventually lead to cancer. Then gallstones. Gallstones are basically hard deposits that form in the gallbladder while it is storing bile. It can lead to colicky pain in the epigastrium and are often associated with nausea. Then comes celiac disease. It is serious sensitivity to gluten. Whenever these patients eat something like white bread, they start having severe bloating and abdominal pain. Gluten is a protein found in wheat, rye, barley. Then comes Crohn's disease. It is an inflammatory bowel disease. Then comes ulcerative colitis. It is an inflammatory bowel disease which majorly affects the large intestine. Then comes the IBS, also known as the irritable bowel syndrome. The symptoms are usually stomach pain or discomfort, and these patients have repeated stool episodes. Irritable bowel syndrome or IBS. The symptoms are usually stomach pain or discomfort. So whenever these patients have a meal, they start having discomfort or stomach pain. Moving on to hemorrhoids. Hemorrhoids are inflammation of the blood vessels at the end of the digestive tract. That is usually around the anal opening. If these hemorrhoids are present inside, they are known as internal hemorrhoids. Sometimes when they start prolapsing out of the anal opening, they are known as external hemorrhoids. Then comes diverticulitis. It is the inflammation of small pouches called diverticula in the lining of the digestive tract. Then comes anal fissures. They are tears in the lining of the anus. Hard stools can usually lead to hemorrhoids and anal fissures. That is why sometimes these patients can see blood in their stool, and they are often painful. Now coming to the female reproductive system. The female reproductive system has two types of organs, internal organs and external organs, also known as the vulva. The internal organs consist of ovaries, fallopian tubes, uterus, cervix, and vagina. As you can see in this diagram, there are two tiny egg-like structures present. These are the ovaries. They produce the female eggs, also known as the ova, and hormones like estrogen and progesterone. Then comes the fallopian tubes. These two tiny little tubes that you can see, which are attaching the ovaries to this triangular structure. These are the fallopian tubes. So when the egg is released from the ovary, these fallopian tubes take up the egg and the egg travels through these tubes to reach the uterus. The uterus is what supports and nourishes the egg, and it is where the pregnancy occurs, the implantation occurs. Then this is the cervix. Cervix forms the lower part of the uterus. It allows passage between uterus and vagina. Vagina serves as the birthing canal. It receives sperms during intercourse, and it is the birthing canal for the fetus to come out. Then moving on to the external genitalia, also known as the vulva, starting with labia majora. This is the labia majora, which protects the external reproductive organs. Then comes the labia minora. These inner lips are known as the labia minora. They protect the opening of the vagina and the urethra. Then clitoris is the highly sensitive structure involved in sexual arousal. It is present at the upper part where the labia minora meets. Then vestibule is the area containing the opening of vagina and the urethra for passage of urine via the urethra and fetus from the vaginal passage. Bartholin glands secrete mucus to lubricate the vagina. Then moving on to the mammary glands. Mammary glands, the main function is lactation, that is production and secretion of milk to nourish the offspring. They produce passive immunity to the offspring by IgA antibodies, which is present in the breast milk. Some of the common problems of the female reproductive system are endometriosis, cervical cancer, PCOS or polycystic ovarian syndrome, primary ovarian insufficiency, uterine fibroids, bladder infections, interstitial cystitis, pelvic inflammatory disease, gonorrhea, chlamydia, infertility, blocked fallopian tubes, or ectopic pregnancy. Ectopic pregnancy is when the implantation doesn't occur inside the uterus. It occurs anywhere outside the uterine cavity, such as in the fallopian tubes. When the egg was being transferred to the uterus, it gets implanted in the fallopian tubes, or outside in the abdominal cavity, anywhere. Ectopic pregnancies are always extremely dangerous. Moving on to the male reproductive system. Male reproductive system, just like the female reproductive system, consists of external and internal organs. So let's start with the external organs. The external organs consist of the penis, that is the external sex organ used for copulation and to expel urine from the body. The scrotum, it is a pouch of skin that holds the testicles in place, and they help in regulating the temperature and maintaining the optimal temperature of the testes for sperm production. Moving on to the internal organs in the male reproductive system. The internal organs are the testes, which are located inside the scrotum. They are responsible for production of the sperm and hormones like testosterone. And moving on to the epididymis. Epididymis is a long coiled tube. Its function is basically storing the sperms, and the sperms mature here. The vas deferens acts as a transport system and transports the sperms. Seminal vesicles, prostate glands, and bulbourethral glands. These are the glands which secrete protein-rich fluid for the formation of semen, in which the sperms swim. Then comes the ejaculatory ducts, which connect the vas deferens to the urethra. Urethra carries the semen and the urine out of the body. Some of the common problems associated with the male reproductive system are erectile dysfunction, premature ejaculation, low libido, testicular lumps, and prostate disease. Let's start with the structure of kidneys. Kidneys are a bean-shaped reddish-brown paired organ located retroperitoneally on either side of the spine. Each kidney has two zones, outer cortex and inner medulla. So the outer cortex consists of nephrons, which are the filtering unit, and they filter out substances which need to be excreted out of the body from the blood. The medulla consists of renal pyramids. So the excreted fluid from the renal pyramids moves into the calyx. There are two types of calyx, major calyx and minor calyx. Then when this renal pyramids drain the urine into the major calyx, that drains into the minor calyx. The renal pyramids drain the urine into major calyx. The major calyx then drains this urine into minor calyx. The minor calyx then drains this urine into the renal pelvis. The renal pelvis narrows down to form a ureter. This ureter helps in transporting the urine from the kidneys into the urinary bladder, where it is stored until it is excreted by the body. The functions of the kidneys include removal of waste products, which is filtering out substances such as urea, creatinine, and toxins from your blood. They help in removing excess fluid from the body. They help in balancing minerals and chemicals. They help in maintaining proper levels of electrolytes such as sodium, potassium, and calcium. They help in controlling the blood pressure by regulating BP with the help of renin. The RBC production or the red blood cell production depends on erythropoietin, which is produced in the kidneys. They also help in maintaining healthy bones by activating vitamin D, which helps in calcium reabsorption and increases the bone strength. Now, when it comes to purification of blood and urine formation, it starts with filtration. Filtration is when the blood gets filtered in the glomerulus to form filtrate. This filtrate then gets reabsorption because almost 80% of the blood gets filtered out in the glomerulus. But a lot of essential things such as water, glucose, iron are also filtered, which our body needs. So then that is where reabsorption occurs and water, glucose, and some important ions are reabsorbed back into the renal tubules. Then comes secretion and excretion. This is where wastes like urea, drugs, which are secreted, form the final urine and is collected in the pelvis and then finally excreted out of the body. The kidneys also help in maintaining balance in the levels of electrolytes and water. If the electrolyte balance is disturbed, it can lead to different disorders. Some of the reasons why this fluid and electrolyte imbalance occurs is when a patient is dehydrated or overhydrated, or certain kinds of medications can also lead to this fluid electrolyte imbalance. Also, having heart, kidney, or liver disorders can trigger this. Also, when IV fluids are given in inappropriate amounts, that can also lead to fluid and electrolyte imbalance. Also, having uncontrolled diabetes can lead to this imbalance. The symptoms of fluid electrolyte imbalance disorders are irregular heartbeat, fast heart rate, lethargy, convulsions, nausea, vomiting, diarrhea or constipation, abdominal cramping, tingling, numbness. The treatment of this electrolyte disorders is via IV fluids when they are given in proper amounts, certain IV medications, oral medications, and supplements such as calcium, magnesium oxide, potassium. And finally, if none of this helps, the patient can undergo hemodialysis. Session, you might now understand what the digestive and the genitourinary systems are, their basics, the anatomy, which organs are involved, how the functions are carried out in the body, their physiology, and some of the common disorders which you can see in a hospital setup. This knowledge will help you in improving the facilities provided to the patients who come with diseases or disorders associated with these systems, such as the dialysis unit, the endoscopy unit. You can understand better about the needs of the patients. You will also be able to interact with the doctors, the nursing staffs better, since you have the basic understanding of these systems and you can understand the disorders better. Understanding the digestive and the genitourinary system is essential for hospital management students to improve patient care, coordinate your services better with the staff at the hospital, and to strengthen infection control practices in the hospital. This knowledge supports better decision making in clinical and administrative setting. Now, to summarize, you know that the digestive system involves the digestion of the food which you ingest and the excretion, while the genitourinary system is composed of the male reproductive system, female reproductive system, as well as the urinary system. These systems work together functionally and anatomically in a very close space. So even if there is a disease of one of the system, it will definitely start affecting the other systems in the body. So that's it for today's lecture. Thank you for your attention. This is Dr. Tanisha Bhatnagar.